Hey, my name is Lauren Tilton, and I am the Antibiotic Stewardship Pharmacist here at Carolina's Healthcare System Blue Ridge, which means that I am specifically focused on improving the use of antibiotics in our healthcare system and our community. This year's annual Get Smart About Antibiotics Week is November 14th through 18th, and the goal of this annual campaign is to raise awareness about antibiotic resistance and the importance of appropriate antibiotic use. So I wanted to take a few minutes to provide some information to you about the use of antibiotics. According to the Centers for Disease Control and Prevention, which is known as the CDC, approximately 30% to 50% of antibiotics are either prescribed when they are not needed, or the patient is given an antibiotic that is not the best option for their particular infection. As the antibiotic stewardship pharmacist, I am working with providers at our hospital and within our community to ensure that our patients are being treated appropriately. In the upcoming cold and flu season, please remember that if you or your child go to the doctor for what you think is an infection, your doctor or physician's assistant or nurse practitioner may or may not prescribe an antibiotic. Antibiotics are not always the answer to treat infections, so your doctor may not prescribe antibiotics if they do not feel they're needed. Antibiotics can only be used to treat illnesses that are due to bacteria, and many illnesses during this upcoming time of year, especially respiratory infections and colds, are actually due to viruses, so antibiotics will not help to treat these illnesses. While antibiotics are generally safe for people to use, they can be harmful to some patients. There are some side effects associated with taking antibiotics, so it's important to not take antibiotics unless they are absolutely needed, as some infections can improve even without treatment. Allergic reactions and side effects from antibiotics are a significant cause of trips to emergency rooms, urgent cares, and physicians' offices. Additionally, each time people take antibiotics, they are more likely to develop resistant bacteria in their bodies. Therefore, when a person needs an antibiotic to treat an infection in the future, this means that the antibiotic may not work. Even healthy people who have never taken antibiotics before can become infected with these antibiotic-resistant bacteria that they get from other people. So if your doctor does not prescribe an antibiotic for you, trust them and know that there is a reason why, and feel free to ask them so that you are aware of their reason. So when you or your child go to the doctor for a possible infection, I encourage you to talk to your provider and ask them several questions. What is the best treatment for my illness or my child's illness? Is there an antibiotic needed for the type of infection that I or my child has? And finally, what can I do to feel better or help my child feel better? Often pain relievers, fluids, saline nasal drops, and warm compresses are the best things to help improve symptoms during both viral and bacterial infections. And if your doctor does prescribe you an antibiotic, remember that it's important to take the antibiotic as directed and to finish all of the medication even if you start feeling better.